COVID-19 infections in the United States are climbing again, even as Washington pushes ahead with an extensive vaccination drive. Inoculations have been front and center since President Joe Biden took office. But health experts warn new variants and vaccine hesitancy are threatening to derail progress. Sarah Walton reports as we count down to Joe Biden's first 100 days in office.
On day one in the job, the new US president made some lofty promises.
We'll move heaven and earth to get more people vaccinated for free and create more places for them to get vaccinated.
100 days on, the landscape has certainly changed when it comes to the country's pandemic response. In December, the Trump administration had vaccinated 2.8 million Americans, far below its target of 20 million. Now around 95 million have been fully vaccinated, nearly a third of the population. Biden is benefiting from that politically, with some polls showing 75% of people say he's doing a good job tackling the pandemic. The president doubled his initial targets to aim for 200 million vaccines administered in his first 100 days and moved forward the deadline for all states to make the shots available to everyone over 16. And now the US leads the world by far in the number of people fully vaccinated.
Now, of course, it's debatable to what extent that's entirely because of Biden. He has done some things that have helped. I think he has provided some clearer guidances than the Trump administration did. He's also been working with the different manufacturers to try to get them to work together and to produce stuff. But he's also been lucky in that, the access has been there.
But his good fortune could be running out. The US Centers for Disease Control and Prevention and the Food and Drug Administration recommended pausing the use of single-shot Johnson & Johnson vaccines after 6 patients developed blood clots. And after 3 months of falling COVID-19 cases across the country, new infections began to rise again from the middle of March. The White House COVID-19 response team has blamed that on the early lifting of coronavirus restrictions in some states and the spread of new variants of the disease. So rather than celebrating the success of the vaccine rollout, officials are doubling down on a message of caution.
We need Americans to do their part. Wear a mask, socially distance, and get vaccinated when it's your turn.
And health experts say the country still faces a difficult task to reach critical vaccination levels, with as many as 1 in 4 people refusing to get the shots.
We're still, I think, seeing some resistance among certain groups, the more high-risk groups, the Latino population, the African-American population. Now, the good news is I think that the Biden administration certainly acknowledges this and that this is a priority for them to start working with the stakeholders in those communities.
After 100 days, Biden does seem to have gotten a grip on the country's response to COVID-19. But the virus has proven unpredictable in the past, and there's still a long way to go in this pandemic and his presidency. Sarah Walton, CNA, New York.
For a closer look, we're joined by Professor Ben-Hur Lee from the Icahn School of Medicine at Mount Sinai. Professor, Mr. Biden's vaccination goals, they appear to be well on track, even as the pace seems to be slowing.
Yes, after all, it has made vaccination more easily to a large majority of people. The restrictions and the type of people who are allowed to have vaccines, or eligible adults can get a vaccine if they wanted to. So I don't think it's gone back. It's just that we are now reaching a certain segment of population that may not want to have a vaccine for one reason or another. And so that's the next part of our task, all of us as science communicators and as educators, to reach these populations that still may have questions.
Professor Lee, there are other areas that we should judge the success of the program on, including whether people are masking up and whether schools are opening. Is the Biden administration setting these kind of key goals?
It's a horribly complex situation because unlike in Singapore, where it's a small city and you have one ministry taking care of everything, here you have 50 different states and, literally 50 different pandemics going on, and epidemics. So you have to take advantage. You have to take into consideration the and as well as positivity rates. So as you all know, some states are not doing as well, whether because it's early opening up restrictions or other considerations. But schools are, if it's safe, they have regulations regarding the amount of positive rates before you can safely open again. But the communication's out there, and they're very smart people working on this full time at the state level. And more importantly, the funding is being provided so that local situations can be addressed.
And Professor, you mentioned vaccine hesitancy earlier. How can those hesitant about taking this shot be persuaded to roll up their sleeves?
That's a big thing. Vaccine hesitancy is a luxury of first world countries, right? So if you're in a third world country, you're just happy to get any vaccine against public health, for public health. So I think what we have to do is not preach the an educational task force that's made up of volunteers from the American Society of Virology. So anyone around the world actually can just log into the site, and there will be town hall sessions where anyone can register for and ask any questions that they might have. I think we have to take seriously the concerns of the minorities, because those of us in academia may be living in ivory towers. We don't know what kind of information that that's percolating around those communities. So you need to reach out to community leaders who are trusted within their communities, and then have them show an example that going to get vaccine is not just about protecting yourself, but protecting your loved ones, people around you who may be more vulnerable. We have to get to a certain level of coverage so that the whole economy can safely open up again, and we're not quite there yet.
Also some hiccups in vaccine production. We saw that 11-day pause on the Johnson & Johnson jab, which was lifted. Was that the right call to have halted production in the first place?
Everything about COVID-19 is a bit politicized these days, so I think they're erring on the side of caution. If any drug you have, there's no such thing as 100% safety of any drug, right? I mean, not to belittle the complications at all. 6 out of more than 8 million doses delivered. I challenge anyone to find a safer a drug anywhere, much less demand vaccines. So I think what this shows is that the system actually works. It's so transparent that even with 6, there's a reporting structure so that we know about these 6, we understand them, and then we see whether the risks, the benefits outweigh the risk. And I think, the reason why the pause has been lifted is now that we understand where they're coming from, and we can safely sort of go ahead and maybe triage those people at higher risk not to receive that particular vaccine.
And one last question for you. Politics aside, what has the Biden presidency meant for the United States in combating the coronavirus?
That's an inherently political question. So I think I would say just based on the facts that it is quite a remarkable thing to have up to 3 million vaccinations a day. So here in New York, we have the Javits Center, literally 24/7. You can go in there and get a vaccine if you get an appointment ahead of time. So now in some states, there's more vaccines than there are takers. And I think what the Biden administration has done is to acknowledge that you need state-level solutions and provided up the funding out there. And more importantly, just as an aside, that we're putting money into genomic surveillance now, which is an important thing to see where the coronavirus is evolving, whether we need yearly shots or not, and without knowing what the spread of the variant is going.
I want to thank you for sharing your thoughts with us, Professor Ben-Hur Lee from Icahn School of Medicine at Mount Sinai.